Hello, and welcome back to the CT Educator Podcast. Welcome back, everyone. Hope you guys are having an awesome week. It is nice and warm, finally. I am so freaking excited. Trying to get over these allergies, so I might sound a little congested on this podcast episode today. So just bear with me because the topic we're going to discuss today is going to be freaking amazing. And I think as new CT technologists and even senior ones, I think there's some good takeaways that you can get from this episode. And always, thank you so much for everybody who listens to this podcast, listens to the episodes. I appreciate every single one of you. And it just keeps this podcast going. So make sure you tell your friends, make sure you tell your coworkers, get it out there in that radiology community. And we talk about all the CT things here. Okay. And I appreciate it so much. So make sure you subscribe, like, share. It just helps keep this podcast going. Okay. So in today's episode, I wanted to talk about, and we're going to continue to talk about, because these topics that I'm talking about lately are some of the things that I am going to be teaching live in my 3-day Be the Go-To CT Tech Challenge. Now, I had to kind of push back the date on my challenge a little bit because of my kids getting out of school and making sure that I devote time to teach these 3 strategies live for you guys. So you can go ahead and just dive in and consume what I got to give you as far as knowledge, right? So the topic that we're going to discuss today is excelling in common CT exams. So how to execute them correctly when you're a new technologist and even if you're a senior one. Okay. So as a new technologist, especially when you're starting out in CT, you want to be just the best you can be. You want to excel in your CT training. You want to learn things correctly, and you want to make sure that you execute those exams that we commonly do in the best way possible and correctly the first time. Okay. So I'm going to be going over some points and just some tips on how you can accomplish that. Okay. So, the first thing that we're going to talk about, and I know I've talked about this on multiple podcast episodes, and I even share it on my Instagram stories or any class that I teach, whether it's a on-demand course or if I teach it live, is patient positioning. Guys, this is so important because this dictates exactly if your scan is going to be optimal and calculated with the correct dose and making sure that you get all the anatomy that is needed for that exam. Okay. Setting up the patient properly. So, what I mean by that is the patient going to be supine? Are they going to be prone? Are they going in head first in the machine? Are they going feet first? You know, so you have to make sure that your patient positioning, that is something that I stress about all the time. Even when I'm teaching technologists out on that floor, I stress that so much because that is something that you need to do and you need to learn like very first, like your first day, first everything, you need to know that. Okay. So how we center the patient, position them, centering along that Z axis. So what I mean by Z axis is if the patient is lying supine, you want to go ahead and line them across, the midline of the body. So your Z axis, okay? That's proper patient positioning. And make sure you use that laser light. Don't freaking guess and think, oh, well, it's this and that. And listen, I'm going to tell you because I am no holds barred and I don't bullshit on my podcast. I'm going to tell you like it is because that is me and that is how I come across because I want you to succeed and I want you to be the best technologist you can out there because that's the goal, right? And it opens up a lot of opportunities when you do things correctly and, you shine. So use that laser light. You have those crosshairs. So from top to bottom and then straight across so you can line up your patient along the Z axis. So make sure that Z axis, those crosshairs, when they go ahead and meet, that it is dead center on your patient. Okay. The laser light is there to help you in making sure you center them correctly. Whether you're doing a head, whether you're doing a PE chest, you're doing an abdomen and pelvis, doesn't matter. Patient positioning and proper centering, that ISO center, is very important. I stress this on almost every podcast episode because I'm going to drill it into your brain because that is something that you need to know and you need to execute that properly. Okay. And then if you work on certain CT systems, let's say, for example, if you work on GE or you work on Toshiba, which is now Canon, I've known it as Toshiba because that's how long I've been in the business. So they have where you center the patient and you have to zero the table before you can even start. Okay. I know those two systems are very unique when it comes to that. You really don't have to do that if you're working on a Philips or you're working on a Siemens. You could just center your patient and you go. Okay. It does have that zero option, but it's not needed to move forward with the scan, not like GE or Toshiba, where it doesn't let you scan until you zero out the table properly, right? So make sure you do that because those are the steps that you need to do as far as making sure your patients center correctly, make sure they're centered to, the starting point. Make sure you get that down pat. Okay. That's very important. And I stress it all the time. Now, the second point that I'm going to discuss is protocol selection. So your protocol is what type of exam are you doing? Are you doing a head that's without contrast? Are you doing a PE study? Are you doing a abdomen and pelvis with IV and oral contrast if needed? Are you doing a CTA head and neck that's with a stroke protocol or just by itself? And with the stroke protocol, CT perfusion. Are you doing facial bones, C-spine? So those are the things that you will encounter as far as what we call common exams, because those are like the bread and butter. I mean, I can't tell you how many freaking PE chest and abdomen and pelvises I did yesterday, and it was a freaking crazy day at work at a trauma hospital. Like I thought I was going to pull my hair out if I had to do, the 100th PE study. But those are the common exams that we do because that is what's commonly ordered. And as you do them repeatedly, you become better and your timing is better. Your injections, as far as timing is better, right? So proper protocol selection. So what I can say about that is that when you have your orders, you make sure that you verify your orders with the proper protocol that you need to select. So you do the correct exam on the patient, right? So the next thing that I am going to point out as far as the next point is your exam setup. Okay, so what I mean by exam setup, you're sitting behind the console, behind the computer. Your patient's already centered and lined up on the table. You've already executed your scout, okay? And you are ready to set up your lines or your box on your starting and ending point. So let me give you a perfect example. If you're doing an abdomen pelvis with contrast, okay, so you want to start just right a little bit above at the lower costophrenic angles of the lung, because radiologists do like to see a little bit of lung when it comes to abdomen and pelvises. Okay. So, because when the patient takes a breath in, remember, the diaphragm's moving. Okay. And you don't want to cut off the liver. So they make sure that those breathing instructions are correct, right? So, and then your ending point is going to be to the lesser trochanter because you want to make sure that you get all the way through the rectum just in case there's a mass sitting there or something that's abnormal that's sitting there, right? So, make sure that you set up your lines and your box correctly when it comes to executing that exam. So, when you're setting it up, okay? And make sure you center all your boxes, okay? Because we have what we call a scan field of view and a display field of view. Now, those are two things that I go in heavily in my 101 CT Basics course. So check that out, if you're interested in that. So, your scan field of view. So basically is the area of coverage that you are going to get within those lines and boxes. Okay. And that's going to determine how big or small your image looks. Okay. And you have to make sure that you do not cut off any anatomy that is relevant to whatever the physician ordered. So let me give you another example of that. So if you're doing the abdomen pelvis with contrast, right? And it's a male and they say, please include the scrotum and the testicles. You have to make sure that you include that and scan the patient to mid thigh, okay? Because they're looking for some kind of abnormality in the scrotum, whether it's a hernia, whether it's torsion, whatever the case is. So you have to make sure that you set up correctly and you don't cut off any pertinent anatomy, okay? So the next thing is the amount of contrast that you're going to give. So an abdomen pelvis. Now, the amount of contrast when it comes to an abdomen and pelvis varies from facility to facility. Okay. I know as a CT technologist myself, because I've scanned for 21 years, I typically give, depending on how big or small the adult patient is, I typically give between 75 to 80 cc's of contrast, just depending on the size. Okay. Luckily, if you get those little old ladies, you could get away with like 65, 60 cc's. It just depends. Okay. So most facilities do have a protocol on how much contrast you give. But what I always tell my techs is use your best judgment. Okay. Like, yes, we have a protocol. You're supposed to give between 75 and 80 cc's. Use your best judgment. If the patient's not that big, give them less because it's going to flow through them more, right? Because it's going to circulate even faster through them, right? Now, when it comes to pediatric patients, we do that by weight. Okay. So it's 1 cc per pound or 2 mLs per kilo. So we calculate that as far as how much the pediatric patient weighs, right? So, and then your timing. So what I mean by timing is how much of a delay or how many seconds you have before it initiates that scan. Now, when we do PE studies, whether you're on GE, Toshiba, Philips, Siemens, you're either going to use something called Smart Prep, bolus tracking, or I forgot what Toshiba uses. I can't even think of it off the top of my head. But you're going to use some kind of ROI, your region of interest tracking to track that vessel. So when the vessel peaks at 100 Hounsfield units, it's going to set off your scan. And within 5 to 6 seconds, it's going to start scanning the patient while contrast is still going. Okay. So your timing. So going back to the example of the abdomen and pelvis with contrast. So we know an abdomen and pelvis, depending on what facility you work at, usually a venous delay is between 60 to 75 seconds. I know at my facility, we use 65 seconds. I've worked at other facilities, we use 75 seconds or 70 seconds. Okay. So it is a venous enhancement. We're not really worried about arterial phase. It's more of a venous phase that you want on an abdomen pelvis. Now, with the PE study, yes, you want arterial phase, which usually their arterial phase is between 15 to 25. And usually 25 is a little bit late, right? So you have to know the timing. Usually timing is built into protocols. If you're an old school tech like me, where we didn't have, the injector counting down or the protocols counting down as far as, oh, this is when you're supposed to scan, we used to eyeball that. Like we used to do our abdomen and pelvises, we would inject, and I used an ancient old scanner that was a single slice. We would give the patients 100 cc's of contrast. We would wait until all of it went in before we would hit the button. And it came out beautiful every time. I still do that practice to this day because there are certain patients who have IVs that may be a little iffy and they're really hard sticks and I have to be in the room just to watch it, just to make sure that we're going to get enhancement, no, extravasations, nothing like that. So every once in a while, I still use that practice. When I just time my own exams. I know on pediatric patients, I time those exams myself as well. I do not rely on the protocol itself to time it. I do it myself because we know as a with pediatric patients, they're small and everything is just going to circulate really fast with them. So if you give them 10 cc's of contrast and then you go back and hit the button, it's beautiful. It's a beautiful study that you get, right? So you have to pay attention for timing of the exam so that you get your exam and the quality of exam in the right timing. Okay. And then the last point that I am going to talk about for this episode is your exam review and completion. So this happens when the patient is completely scanned. You're completely done with scanning the patient. So you need to go back and review your images. I can't tell you how upset I get when technologists say, okay, we're all done. Well, did you review your images? Well, no, I got everything. And then we come to find out later that there's all kinds of motion on the exam. And then we have to bring the patient back and rescan them. Like, how fucking irritating is that? Okay. As a new technologist, it's probably irritating. And me training you, it's irritating because I'm telling you how to do things the right way. So, my biggest point and takeaway of that is after you're done scanning your patient, take a few minutes, review all your images for making sure that you covered all the anatomy, making sure you're looking for any motion, because if there's any motion, you do have to repeat certain sections of that scan. And make sure that you have proper contrast enhancement. There's no infiltration, something didn't go wrong, not enough contrast went into the patient. Make sure you take a few minutes to review that and tell the patient, say, we're all done. You can put your arms down. You can relax. I just need to review your scan before we take you off the table. And I'm telling you, patients appreciate that because then you prevent them from coming back and getting another dose of radiation because you fucked up. Okay. In a nutshell. So these 4 things are good practices to make sure when you are out there on the floor in training and making sure that you do things correctly. These are some points that I want you to take away and remember. So when you're out there and you're working, that you set up everything correctly. Because if you do it right the first time, you're going to do it right every single time. Right? So that is it for this episode. I hope all these points that I made in this episode are really helpful. Okay. Let me know. You can always send me an email. Everything will be noted in the show notes. Come to the challenge. I am going to host a live 3-day challenge on how to be the go-to CT tech. Some of the points that I discussed in this episode, you will see me teaching live in those 3 days. All right. So I will have more information about when I will drop the dates for this challenge. I know I was going to do it May 2nd and 3rd. However, there are some things with my children that I do have to make a priority. So I am pushing back the date. Okay. So make sure you stay tuned. So I will go ahead and link where you can sign up for the challenge. Okay. And you can get all the information. I'm going to be teaching it live. I'm going to be going over 3 strategies on how to be the go-to CT tech. Doesn't matter where you are in your training. This is for everyone. Okay. And as always, come follow me over on Instagram. Let's chat. I'm going to start posting more content. Life always lives. So, and shit happens. But now that summer is here and I'm having more time to do things, you will see more content on Instagram. So make sure you give me a follow there. And as always, thank you so much for supporting this podcast. I appreciate every single one of you that listen to these episodes. It is just such a blessing. And I'm super grateful for it. So thank you so much to all of you that have listened to this episode, listened to the podcast. I will chat with you next week.